Hello, let's talk PCOS acne so that you have the information you need to stop wasting your time, money, hopes, and dreams on acne solutions that will not work for PCOS type acne. I didn't know a lot of this information when my acne was at its worst, and I paid for it, literally and emotionally, because it was painful. So hormonal acne is completely different from the other types of acne. This PCOS-based acne, it really has more to do with the androgen receptors in your skin, particularly on your jawline and around your forehead. And basically, your body's hormonal receptors and your hormones are not interacting appropriately, and they're causing this inflammation in your face, which then causes the cystic acne to appear, and it's very painful. At least it was for me. All right, so there are lifestyle solutions and there are medication solutions, and of course you can use a combination of both, and there are supplements. I'm going to go over each step by step, but one really important point is that this isn't teenager acne. So going to a drugstore and spending money on the general over-the-counter sort of acne solutions could make this worse for you. You could be irritating your skin because if you're an adult, your skin is thinner than a teenager's, who most of these treatments that are over-the-counter are designed for. And it's not intended to address the type of acne you're experiencing. So generally speaking, most dermatologists are going to recommend really gentle, even all natural cleansers, and that'll be much easier on your skin and help actually get that inflammation down. I'll link to the cleanser that I like to use that has great reviews from the environmental working group, so it doesn't have a lot of fake icky stuff in it. Okay. Medications, there are 3. Birth control, surprise, surprise. Certain birth control pills, so not all of them. Make sure you talk to your OBGYN and let them know that one of your objectives in taking birth control pill is to manage PCOS acne. But certain birth control pills can sort of be a band-aid fix. They sort of level out your hormones superficially. They don't get to the root cause, but they will give you some relief, and that is valuable, and maybe it's worth it to you in this phase and stage of your recovery. Another drug is spironolactone. It is a diuretic, so it's often used with people who have blood pressure issues, but it's also safe for women to take to manage their acne because it has this interesting side effect of reducing androgens, which is a primary driver here in this hormonal acne. So taking that is a good option. However, it is not a good drug for pregnant people, so probably not a good option if you're looking to have a baby anytime soon, or you're breastfeeding, or you're pregnant. And then also another drug that is available to you is Accutane. It's a long-term treatment plan. It has some considerable side effects, and it is definitely not healthy for women who are pregnant or trying to become pregnant, but that is available to you in some cases. Okay, so let's move on to lifestyle, things you can do so that you have a long-term plan for getting at the root cause of your acne, which is actually systemic inflammation and insulin resistance are the 2 things we want to address. So eating a PCOS-friendly diet, once again, is going to reduce your insulin resistance and reduce the circulating insulin in your blood, thus helping you reduce the androgens and testosterone in your blood that are causing some of your PCOS problems. Also, PCOS diets are anti-inflammatory, if you're following them correctly. So that's going to help reduce some of the systemic inflammation that's coming from your gut and your other bodily systems that are contributing to this type of acne. So I'm pretty open-minded when it comes to PCOS and dairy. I see arguments for why you'd want to keep it in and why you'd want to keep it out. There's no conclusive proof that you should take it out. But with acne, this is one time when I really think it's worth you cutting out dairy big time for like 6 months, like really cut it out, because there's just a lot of anecdotal evidence, and there's a lot of just in general with health and wellness practitioners, there's a lot of correlation that they see between dairy and PCOS acne. So I think, if you're really struggling with PCOS acne, you probably don't care about cheese as much as you just want to be out of pain and embarrassment of having the acne all the time. So I think that is worth a shot. Now, when we talk about inflammation, we're talking about your whole body system, not just your skin on your face. And one of the biggest sources of inflammation in PCOS is an unhealthy gut microbiome. So ways that you can get your gut healthy, I'm not going to do a deep dive, but just some things to think about in research are taking probiotics and eating prebiotic foods like your vegetables and fruits, and for naturally fermented foods like sauerkraut, kombucha, kimchi. Those are all good examples. All right, now let's move on to supplements. All of the supplements that are just kind of like good baseline supplements for PCOS could just help your overall bodily systems and reduce inflammation. The one that I'm particularly interested in for women who have a big problem with PCOS acne is berberine. Berberine has qualities in it that help reduce insulin resistance and kind of slow down that whole insulin, high testosterone cycle. And it does it very well, just as well as metformin in medical studies. And along with that, it seems to do a really good job at reducing hormonal acne through other pathways. So I think that it's a really good choice for women who are struggling with acne. However, berberine interacts with a lot of medications. So if you are on medications, I would talk to your physician before going on berberine. And even if you aren't on any medications, I would do a lot of research on berberine because it's a powerful herb. And in fact, you might even want to talk to a health and wellness practitioner who can guide you in taking that. The general recommendations that I'm seeing are 500 milligrams twice daily, and you take it for about 2 to 3 months, and then you take a month off, and then you go back on. So it's like a cycle is how you treat it. And also it is helpful to take this with a probiotic. And when I say with a probiotic, I don't mean at the same time. You actually want to take the probiotic separately. But berberine has some helpful actions on the gut as well for reducing inflammation. And when you add the probiotic to that, it can really help getting at that root cause inflammation that is giving your acne fuel for the fire. Okay, so I hope that helps. I would love if everybody could comment below on what's working for them with their acne. Really for me, the biggest things were just diet and lifestyle and patience, lots and lots of patience. And I know that when you have acne, you want it gone yesterday. So it's hard. It's hard to hear the word be patient and let your body heal. But I think if you incorporate lifestyle and maybe some of these supplements, you could be on the path to healing tomorrow even. And these medications are also a valid and worthwhile avenue to explore if you're really struggling with your acne. You need to talk to your physicians, your healthcare team, and make the choice that's best for you.